What if your voice held the key to healing pain, fixing your posture, and even your emotional well-being?
You see this a lot. Teenagers now coming in with headaches and problems with their neck. But it's all because they're just like that.
In this episode, physiotherapist Ed Blake demonstrates how tiny muscle adjustments in your neck and jaw can transform your voice, ease pain, and change how you feel throughout your body.
Your voice is so important in your identity and your confidence. That's what you really notice. Wow, my voice is kind of loud now.
Through the inside.
Before it would sound constricted, and all of a sudden it's forward. This is me and I'm here.
I feel like there has way more openness.
Movement's the key. Over time, these muscle patterns become embedded. The thing you want to avoid, it just as a fundamental basic principle is
Hi, thank you for watching this new episode of the HumanWare Project. Please subscribe to our channel. That means a lot to us and will make us going further with you together. Thank you. Hi, Ed. Welcome to the HumanWare Project.
hi, thank you.
I'm so excited for today's topic. Could you tell us what exactly you do on the larynx and on the voice and why it is important?
So primarily, the clinic works with patients with a diagnosis called muscle tension dysphonia, which is a dysphonic or compromised speaking or singing voice, which is caused by muscle tension.
So I will read something now and we can see if there has any difference of my voice. Together we are creating a future where everyone has the knowledge, tools and community support to reach their full potential, and where each person can write their own story of growth and discovery.
What the treatment does is it releases the tight muscles that are holding the larynx in an elevated position, and combined with the stretches, it brings it down. Now all of a sudden you've got some play with your larynx so it can start to move. So this is the Sternocleidomastoid. It's a massive muscle on the side of your neck. When tight, two things happen. It limits how much your larynx can move. It causes it to elevate slightly and it becomes sort of rigid in its elevated position. And that's a problem for voice users because it makes it very hard to resonate, change pitch and work efficiently.
Those tensions can develop for a lot of reasons. Some of them have nothing to do with voicing. They can just be postural, forward head positions using your phone or laptop, that kind of thing. Some of them are to do with illness or injury, and some of them are related to how one uses their voice. The treatment's designed to alleviate the sort of muscle tension that's developed over time, and that improves the mobility of the larynx and specifically the way that the vocal folds function.
And all I'm doing here is just maintaining the stretch on the muscle, put a little bit of pressure on the trigger point, and that elicits the headache. And then we just move your head slightly like that, and that just places the muscle on a stretch. And that's the most effective way to release it. And it also gives me the most information about how that trigger point is responding to the manual therapy.
Could you tell us a little bit about why voicing is important?
I think that your voice is so important in your identity and your confidence. It's one of the primary sort of complaints that people make when they come to the clinic about how their voice isn't working is that loud social places, they either can't be heard, or if they have to force their voice to be heard, it tires very quickly and becomes very painful. And then they just don't want to go out because it's not fun. The timbre of the voice and the resonant quality for me is a massive element of that. And that tends to be what is affected with muscle tension dysphonia.
What this muscle is primarily involved in is protecting delicate structures in your neck. So if someone was to bump into the back of your car and you got a little bit of a whiplash, this muscle is designed to kick in to prevent those forces from transmitting through to the nerve tissue and the discs and all the delicate bits that are in your neck. We often use it just to support the head and neck when we're just working at our workstation, or we're carrying some shopping bags or anything like that. It's habitual patterns of movement, and before you know it, for a lot of people, this muscle becomes very, very dominant. And so when it does become the default stabilizer, we start to see movement problems, both in the neck and definitely around the larynx. But what this is doing is it's allowing me, you'll notice I just slightly adjust your head and neck position whilst we keep the pressure on. And it means that you can just flex your neck a little bit more. And that means your larynx is going to drop a little bit. And that gives me a chance to release the structures at the back of the larynx. There it is. Boom. Good. All okay?
Yeah.
Good.
I have to say I got quite surprised after I go for one of your treatment. And right after, how I feel is my chest is like a chamber, and there has resonance. Like when you go to a theater, there has the booming sounds within and then reflects out.
Right.
So could you tell us what happened there? Like when you do the manual adjustment around my muscle, and what happened? How can that happen so fast?
Okay, so that's how the resonance improves, and that's a big part of the sort of treatment benefit. So what happens is that you create sound in a chamber, and if that chamber becomes, sort of compromised, it's smaller and it's less flexible, then there's an immediate impact on how that sound is created.
Right. Fold the tongue for me again. So now I can get in behind the hyoid bone a little more easily than I could earlier, and you'll start to feel a little bit of a stretch when I do that. And we keep again on pressure, and we just work through just trying to release. And now I'm just going to bias this stretch so it's in a little bit more of a downward direction, and that's just to take advantage of the release work we've just done.
In your particular case, what we did was we lowered the larynx a little bit. That makes that chamber bigger, and then the sound can resonate better, and that gives you much more sort of forward voice production and the improved resonant quality.
How are we doing?
Very sore.
Yeah, it's a little tight, isn't it? Do you want to do your reading again now? We just have a little progress check and just see how the voice is sounding.
Okay. Our vision. Together, we are creating a future where everyone has the knowledge, tools, and community support to reach their full potential, and where each person can write their own story of growth and discovery. I feel like the location where my sound comes from is a little bit lower.
Yeah, so the larynx will drop a little bit.
Yeah.
And that to me sounded a little bit more resonant as well, and that's because the shape of the chamber is bigger.
And that's what you really notice, because you're like, wow, my voice is kind of loud now. Whereas before it would feel and sound a little constricted and a little back in your throat. And all of a sudden it's forward, and this is me and I'm here.
You ready for round two?
Yes. Right after the treatment, it almost feel like it's so much easier to speak.
Yeah.
Even though it's a very tiny treatment, that really made me start to think, if we are a piece of humanware, how can I make sure the hardware is so in alignment, so whatever I want to do or want to create don't be holding back by my body.
What you're really talking about there is efficiency.
Now this time I want you to relax your tongue back and let it drop, and I'm going to keep a little bit of pressure here. And what I'm doing here is rotating a little articulation called the cricothyroid joint. And the cricothyroid joint is absolutely critical in elongating and shortening your vocal folds. And that's how you change pitch. It's like a guitar string, so the more tightly strung, the higher the pitch, the more loosely strung, the lower.
Do you think our body is an instrument that we can fine-tuning?
Absolutely. Our body is the ultimate instrument.
One of the main symptoms that people come in with is fatigue. And that's a reflection of a system that's not working efficiently, so it tires prematurely. So it's the same if you were running or swimming. If you swim badly, you'll be far more tired after 3 or 4 lengths than is someone who's swimming with a beautiful sort of hydrodynamic technique. Your musculoskeletal system is exactly the same. What we've done with you is to make the muscles more balanced. So, there is a better interaction between the muscles that affect your your larynx. So everything feels easy because you're not fighting against resistance and you're not fighting a badly positioned larynx. Everything's where it should be.
Right, let's have you sitting up very slowly. This time I'm going to draw the larynx down, and you look up and just let me know how you're feeling. You fold the tongue like you were when you're lying down. That's the way. And I'm just supporting the back of your head just so the pressure's not on your neck.
I know you're quite well known in the professional circle, especially a lot of voice and singers, they come to you. So normally, what are their complaints before they came, and what are these treatments are changing them after?
So their requirements are different. It depends a little bit on the genre. The Wicked movie, for example, where they use a lot of belt quality. So that is a very difficult quality to create, and it involves the larynx sitting in a very elevated position to make that sound. It's about repetition in the West End because the songs and the vocal responsibilities are pretty much identical night after night after night. To get that level of performance consistently takes a big toll on the body. If it becomes muscularly sort of tight, then it has a big impact on their performance. With those artists, once we've alleviated some muscular problems, that they can then work on sort of improve technique to get through the demands.
What are their routine like to support them to go through a very long journey of the work?
It probably varies a little bit from artist to artist, but you're looking fundamentally at a few different things. From a voice point of view, they'll be looking at their technique all the time. Like all of us, we have the ability to drift into bad habits. Most of them will have regular singing lessons with a very highly qualified singing teacher. They're a big part of this. If there is a musculoskeletal problem, the clinician can sort that out, but the singing teacher will help them, improve that aspect of it. There's lots and lots of variables. So they have to look at all of it.
People often think that singers just stand up and sing. That's not true. They work unbelievably hard. If their technique is poor and their voice fatigues or suffers, cancelling concerts and so forth is really bad. So they work to a place where they can reproduce that high level of performance night after night after night after night. That's not talent, that's hard work. As you said before, our body is an instrument and we need to maintain it, and kind of misusing it or abusing it does not give you the longevity that you need.
For everyday people like me and our audience, sometimes we might have a lot of tension in ourselves. We don't know. I think in a way we're all actors and actors in our own play, in our own life. When we're sitting down a lot with the computer, sometimes I can sitting 4 hours straight, not moving, and I can feel very heavily on my shoulder and back. What are we going to do in the modern society when we're sitting down a lot? Is there anything we can do as a daily habit to improve our postures?
Yeah, 100%. There's lots you can do. And where it's got a little bit more complicated is working from home. I know people that work from their bed, but they work from their sofa, or getting that kind of ergonomic setup right so that your posture is as well aligned as it can be. And that's meaning get a decent chair and make sure that the keyboard's at the right height and that the monitor's at the right height and that sort of stuff. The thing you want to avoid as much as anything is when your chin pokes forward.
Is there anything I should be aware of when sitting down or when I look at my phone?
So what people do is they just hang on their neck, and you see this a lot with teenagers now coming in with headaches and problems with their neck, but it's all because they're just like that. For all of your listeners, it's about chin forward like that tends to promote muscular problems, which are then reflected in other parts of the skeleton. Mm-hmm. And the more that you can spend in that position by training those muscles to automatically kick in, that's how you buy a long-term sort of insurance for your spine and your larynx.
People often end up in that position because they're slouching. Yeah. The sort of trade-off for that chin forward is that the shoulders will go as well, and then your mid-back muscles effectively switch off, and that becomes our normal. But you pay a price for this down the line. Over time, these muscle patterns become embedded, and the restriction that is created in the muscles that are shortened starts to impact on the more delicate structures like the vertebra in your neck. And that's when you hear about people having disc prolapses and facet joint injuries and these sorts of things. One of the things we see a lot in clinic is, I don't understand. All I did was bend down to tie up my shoelace, and now I've got this really severe, injury. But it's not that one event that caused the disc to prolapse. It's essentially the straw that broke the camel's back.
That's true. When you said that, I remember I used to be an art student for many, many years. Every single of my teacher got a back problem. And I was like, oh man, that is almost seems like a dead end to being in this career, because when you are in creative flow, of course you are going to be like, forgot the time, but then your body is paying for it. What will be your suggestion from the beginning stage to, for them to find that perfect posture?
When you're in that zone, nothing can interrupt because, the focus is there. It's about having generally exercises that engage muscles that we don't routinely use when we're hunched at a keyboard. That means that if we do something regularly to target that and keep them engaged, the imbalance is never going to get so drastic that it starts to cause actual injury.
Is there anything our audience can do at home if they can't come here in person?
Stretching your head side to side is not something that we really promote, certainly here. When we put a lot of pressure through the neck like that, the delicate structures can take a lot of pressure, and to protect that, you tend to then engage with that sternocleidomastoid, which is what we've just spent the last half an hour releasing. A better way to stretch is to actually try and get into this region here, because this is something where a lot of people develop a lot of tension. And the way you do that is we get that hand there, and we get this hand, where's your other hand? And we just do something, it's a little bit like out of a yoga class. We keep the head and chin in a nice sort of neutral position, and the key bit here is just to lower the shoulders and just keep those hands just going towards the ceiling a little bit, and just keeping these shoulders down when you do that. So they're sort of going in opposite directions, and that should be giving you a little stretch there. Yeah, you're getting something? Mm-hmm. Great.
Is there anything else I can do to, further relax my shoulder?
So part of relaxation is also strengthening something that prevents this from working. Okay, so we could give you a strengthening exercise here. Okay. Hold that there. Mm-hmm. This comes around the back. You hold that there, right? Yeah. You put your elbows into the sides, and you just rotate out like that. Okay. Now all you do from there is you just push it, so just out to the side like that, and then just back in. And what happens here is that when you do that, this area here is working it. So that's the other way of relaxing that, is you stretch it, but then you engage through there.
Okay. I start to put more awareness on my health, and I start to notice, well, I feel good, but I can feel better. And physical wise, maybe I wake up with some kind of tension in my neck or my legs. So if I design a brighter future for myself, what will that look like?
For me, it's just habit training, but get good habits in place. And it's really hard because we are pretty reactive. Most people don't do a lot until they get a problem, and then they'll do something to get out of pain, and then the pain goes and the motivation goes. And so what I always say to patients is, for this kind of thing, find out what the key areas are to strengthen or to stretch. And when you go to the gym, try and incorporate that into one little element of your gym workout. So if you're having a little 10-minute break between the treadmill and your weights program, that's the time to get on a mat and do your stretches or do your strength exercises as though it was part of your weight routine. And psychologically, you don't feel like a patient anymore. You feel like I'm just doing my gym workout, which I do. But what you're also doing is you've targeted a small percentage of that time to making sure that the body's going to move efficiently.
I totally get what you said, like especially the piece you have touched based on you think that all the kids need to learn this from school. I believe we are a piece of humanware, but we are come to this world without a manuscript of how to work on it. And how I feel for all the physiotherapists, they are like the mechanics on treating our body to tell us how you function better.
Yeah.
But as a patient, we probably don't have the same kind of knowledge on that. So much rather fix it after. What about we just start a good habit from beginning?
Yeah.
Because it's the same effort regardless.
I totally agree with that.
So what we do here is I just block your shoulder like that. And this is really important because it gives you a sort of a kind of foundation. And then I put a little bit of pressure on that scalene. And then I just very gently just flex the upper cervical spine, but I keep the pressure on that middle scalene, so there it is. And again, same thing, it's just about getting length on the muscle. Can you just feel a little bit of stretch going on there when we do that? Yeah, stretch through. So everything's got a consequence. So if the sternocleidomastoid, that sort of powerful muscle there, is really tight, then it tends to compress the upper part of the neck back here, okay? So a lot of people present thinking that they've got all this tension and pain at the base of the skull, and they do, that's not in dispute. It's more what's causing that compression to occur. And I would argue that in most cases it tends to come from this area here. That's the real skill in manual therapy, is identifying what is putting the pressure on the area where one is feeling the symptoms.
But if our muscle learn to do certain things, how can we reprogram it? Is that possible?
Yeah, absolutely. So it's a super malleable system. The issue is you have to dedicate a lot of time to reprogramming it. You have to create an environment in which it can be reprogrammed, so you have to make the dominant muscles less active, and then you have to engage with what's called their antagonists, the ones that do the reverse, to make sure that they start to become used instead of the dominant muscle. Okay, looking good. Let's try that reading one more time.
Our vision, together we are creating a future where everyone has the knowledge, tools, and community support to reach their full potential. A world where breakthrough innovations in longevity and brain health become accessible to all. I can feel the difference.
Yeah? I
Yeah.
can hear it.
Yeah.
Feel easier to speak?
I feel like a stereo, like a speaker, right? Like you put on the bass. If we simplify the whole routine of, let's say, in a perfect world, if time and money is not a problem, what will be the good routine for a person?
It probably depends a little bit on your starting point of your body. Movement is critical for all the systems in our body, right? Your cardiovascular system, obviously, if you go for a run, gets a good workout, but that movement also means the lymphatic system is moving better. Your digestive system works better the more you move. And everything that we do requires movement, and people that don't move, basically their bodies don't work very well. I think stretching's one that we tend not to sort of naturally do because there's no kind of objective improvement for a lot of people when they stretch. But from my experience in clinic, a lot of what we see is this cumulative build-up in tension and restriction in muscles, which means that an adjacent area is being loaded because of that restriction, and that's where the injury comes from. If there was a time where they said, right, I'm going to do a 20-minute stretch routine off an app or something once a week, that's great because it just resets all the tension levels.
So in a summary, that people should incorporate more movement into their daily life, also stretch, and if time allows or if they happen to find a good physio, they should go see their physio to see what they could not see.
Movement's the key, and then keeping the body just in a relative balance. If we do repetitive movements ongoing without addressing it in some capacity, it will just build and build to a point where the body just doesn't function well in that setup, and that's the injury.
Yeah, when you talk about injuries, I actually want to touch base on few very common things. The first thing is headaches. What are the headaches? Is there a headache that causing by our larynx or jaw tension?
Well, the muscles around the larynx, yeah, absolutely. So if we talk about what's called cervicogenic headaches, because there's lots of causes of headaches.
What does that
So
mean?
cervicogenic headaches basically means a head pain that's coming from your neck.
So you first feel here and then go to your head?
Yeah, absolutely. So there's a few structures within the neck which are very capable of referring pain into your head. And most of the areas are just over the eyebrow, into the temple, sometimes behind the eye, and then this place called the nuchal line, which is just the base of the skull. There are certain muscles that are really overused in society, like the way that we live, which can give you headaches. All these ones that we worked with you just on the sort of lateral, sort of front muscles through the neck, there's a lot of correlation between head pain and overactivity in those muscles.
There we go. Just point to where you feel. And just straight over the eyebrow.
The structures that give that head pain, are quite clear, and we will replicate it during the treatment, so the patient will be like, I recognize that headache. People are stressed. They clench their teeth at night, and when you clench your teeth, of course you get a lot of jaw tension, jaw muscular tension, but you also get a lot of neck tension too, because the neck provides a basis from which the jaw can then clench. It's like this sort of support platform, and people wake up with bad headaches.
So one of the big sort of issues that we see here is the consequences of what we call nocturnal clenching or grinding. This can all get quite tight when someone clenches their teeth. Just a little bit of jaw opening. Good. This is a really important point to keep mobile, and that's why it's so sore, because it's super tight. Yeah. And I'm just using the side of my middle finger just to slide up against the
That's so
I know, it's really, really tight.
Feeling you're pointing at my skulls.
And now you open wide on your own. Yeah, good. And close. How's that feeling?
Oh, better.
Yeah, it's good. It's moving now. You can just feel that push into my fingers when you do that, right? And that's, again, how I get the feedback. And I'm going to sneak in through the inside. And this is what's called the medial pterygoid. And now you can open your mouth a little bit wider. Good, all done.
Is that painful?
Yeah, it's horrible. It's horrible.
Yeah, I almost feel like this part have a little bit more room than this.
Well, that's right, exactly what it is. So all manual therapy is about creating movement. And it should be creating movement in areas that are lacking movement. There you go. So there's a little tunnel we go through there. Now you can open wide. There we go. And I can just sit on that medial pterygoid like so. Good. And all done.
That is painful.
It is painful.
I feel like there has way more openness to my mouth.
And that has an impact on how your larynx moves as well. Got to keep those stress levels down, the clenching to a minimum.
Thank you for mentions about clenching your teeth. Trying to puzzle the puzzle here, because I have asking somebody, professional scientist and also dentist, why we clench our teeth at night. From your perspective, why do you think it happened? And is there a way to stop it?
I think most of the time it's due to people feeling anxious or stressed. I mean, I think it's a big element of it. Our body is an amazingly sort of programmable instrument. And if we decide to change something, whether it's physical or behavioral, we can do it. I mean, if you look at something like the pandemic, we changed the way we live quite radically, really quickly. And then it becomes kind of like, okay, we do it like this now. And our body's really similar, but it has to have an environment to change. So if we get in the habit of clenching, then what you'll find often with people is that the brain is just going, oh, okay, it's nighttime, now we clench. And trying to break that cycle can be difficult. Some of it's mechanical, so you can work on the muscles around the jaw to alleviate that. And then there are a lot of strategies that people use about how tense they are before they sleep, like, not reading screens, just as you go to sleep and that sort of stuff, and blue light and all these sorts of factors. And then the actual physicality of it. And some people say, they use guards to help change the bite position so that you're breaking that habit. It's not always effective. It's all about change. You've got to change the habit and the physical setup.
Right, so that's really good. So that hyoid bone is moving beautifully now. Let's have you sitting up very slowly.
Yeah, I can feel the flexibility here.
Yeah, that's right.
Our vision. Together, we are creating a future where everyone has the knowledge, tools, and community support to reach their full potential. A world where breakthrough innovations in longevity and brain health become accessible to all, and where each person can write their own story of growth and discovery. Nice, I like it.
That's the effect, right? So the muscles are what control how your larynx moves, and if we get them working for you rather than against you, then everything within that laryngeal mechanism works the way it's designed to, nice and efficiently, and that will last, provided that we can keep those muscles relatively well balanced. But that sounded good.
Over here, before I touch it, it's like one block of walls, and now it feels like a lot softer, and my neck feels released. Can you walk us through, if I'm a patient come to your clinic, what will be the experience like, and how often should I come? Is that one treatment enough?
What you really want patients to leave with, and I always say this to my staff, it just is a fundamental basic principle, that was worth travelling to the clinic to have that treatment. Anyone who leaves wondering why they bothered is a sign that it was probably not very good. And how does one make a patient feel that their effort was worthwhile? Was working with the patient. I'm a really big one for like, okay, this is teamwork. I can absolutely help you, and you can help me to help you by working out how we can put something in place outside of clinic treatment, and the clinician being a little bit adaptable and a little bit flexible, because a lot of people have different views on stuff, and if they want to do something because it's really important for them, I don't know, they want to play tennis once a week because that's their social life, and they've got a shoulder problem, just putting this blanket ban on something that impacts a huge amount outside of the actual shoulder, we can be better than that. We can work a way to keep that in their world and still get their injury right. That's what I really like about good treatments, is that they're actually focused on trying to help someone through their own individual issue, not impact other components of their life, and them start to see a relatively immediate kind of improvement. So they think, this is good, I can move more without pain, I can sleep without it waking me up, I can get through a day at work without having to think about my things, so I can keep my focus where it needs to be. That's a good appointment.
That's a good one. When you mentioned about sleep, I realized I forgot to ask a very key question. If somebody have insomnia, maybe part of it is psychology issues, but what are the physical issues can cause us to have insomnia, and then how we treat it?
In the physiotherapy world, we tend to refer to it more as just sleep disturbance. Most people with musculoskeletal injury will be able to sleep. It's just whether or not they can have a prolong sleep without waking because of their injury. So different structures and different inflammatory states can affect very much the quality of your sleep. So if you've got a lot of nerve pain or arthritic pain that's in a very acute flare, it's hard to sleep through the night with that. It generally will wake you up, and often it's a lot of medication or homeopathy-based things to help facilitate some sleep. Sadly, the only way you get through that really is to get the problem resolved, and that's usually working out what the right treatment strategy. So, I think for a lot of people, it's just getting the inflammation down. It's getting, neural or nerve-related symptoms to calm down, and it's like trying to sleep with a toothache, isn't it? It's hard.
Yeah, that's true. Coming out of physio treatment, I really feel there has a bigger range of the voice, and also I feel there has much more resonance. It's almost like my chest is a bigger base of the sound to flow inside of it. So for me, I always feel like our body is like instrument, or how we call it, the human wear. And every day my job is to take care of my little piece of human wear to make it so happy, so good, so that I can perform the best. Final question, if you give our audience one longevity tips on how do we keep our posture, our voice, what that will be?
If we link the two, so posture and voice, the main thing is just keep your head in a position where the chin isn't poking forward. And you can catch yourself in this stuff, and just never beat yourself up about it, because we all drift into postures that aren't ideal. But just work the muscles in the mid-back, lots of strength in there. Your head's heavy, and if you put all the muscle work around the neck to hold it, then the larynx can't move, and this is a big part of what we do, is say, right, let's redistribute where the muscle work is occurring so that it doesn't impact on neighboring structures. So for me, watch the position in the first place and really work those mid-back muscles, because they're strong, and if they're engaged, then your head and neck are in a much better position, and then you don't have the fallout from it being continually in a position where the chin is forward.
Thank you very much for today's time.
You're welcome. It was a pleasure.
Thank you for watching this episode. Your support will mean a lot to us. Please subscribe. That will help us to bring even more amazing guests in the future.